My name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Healthbeat show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Deanna Orfanidis, NMC's new Chief Nursing Officer, and we're going to be getting to know her a bit better today and welcome her to St. Albans. So good morning and welcome.
Thank you, Jill. I'm really glad to be here with you today.
Well, we're so excited as well, and to be able to introduce you to the community as our new Chief Nursing Officer. It's fantastic. So let's tell our viewers a little bit about who you are. So if you could just introduce yourself and tell us whatever you'd like.
Sure. Good morning, everyone. I'm here today as your new Chief Nursing Officer for the Northwestern Medical Center. I'm really excited to be here and a part of the community. My previous experience, I'm known to Vermont. I've been the CNO at Mount Scottney Hospital and Health Center in Windsor, Vermont, a part of the Dartmouth-Hitchcock system.
That's fantastic. Now, how long were you at Mount Scottney?
I was at Mount Scottney in the Chief Nursing Officer role for 3 years, and prior to that at Dartmouth-Hitchcock Medical Center, where I spent most of my career in a variety of roles throughout the system, at least, I think when I look back, 30 years.
Really? So you spent 30 years in the Dartmouth system?
Yes,
wow. Absolutely. So it's like, did you start like as a staff nurse and then work your way up?
Absolutely. I graduated from Castleton State College in Castleton, Vermont. And actually, I was planning to go to Boston. And at that time, if you can appreciate, not similar to today, there was an abundance of nurses. And it was a little bit difficult to find a position. And they had offered me a position downtown in Boston and had to withdraw it because they needed to freeze related to their financial stability at that time. And fortunately, I had the opportunity to interview and was hired as a new grad on the neuroscience unit at Dartmouth-Hitchcock Medical Center.
Wow.
Yes.
So when you left Dartmouth, you didn't leave the whole system. You went to Mount Scottney. What was your job, your last job in the Dartmouth Center?
Yeah, my last position, I was the Associate Chief Nursing Officer, and I had oversight and responsibility for critical care services, all of inpatient surgical services, and a variety of ancillary departments, which included vascular access, food and nutrition, the trauma program. So I had a bit of a opportunity in regards to all of hospital operations.
Wow.
Yeah.
Well, you've come to us with a lot of experience.
Well, it has definitely prepared me to have the opportunity at Northwestern to really lead nursing, as well as partner with my leadership team colleagues to really bring the best to our community.
I'm always so interested to ask nurses, or actually anyone, but nurses in particular, because I'm a nurse too, of what brought you to nursing? How did you make that decision that nursing was it for you?
Jill, that's a great question. Whenever I think about myself, and my family will kid me because I will introduce myself as a registered nurse. So I knew that when I was younger, I had actually participated in being a volunteer in nursing homes. However, as I got older and I was thinking about a career, I really understood that I had a aptitude for sciences, and really felt that, what could I do in that space? And I never look back. I'm so grateful for my career as a nurse. There's always something new you're learning, and you expand on that knowledge as you go through, your experience as well as your background related to healthcare. So. It's been a fantastic opportunity, and there are several times in my career that I've thought, this is your opportunity. Reevaluate. Is there anything else you might want to consider for my career?
Yeah.
And I always came back to my commitment to nursing, the profession, and our patients and families.
Wow, that's heartfelt. That's
Absolutely.
That's you. Nursing at your core. So on your journey at this point, what are you most proud of being a nurse or a nurse leader?
Well, I know that I've always had multiple things in which I am very proud of, but I would say that my ability to lead nursing and really wrap ourselves around our accountability to our profession and our commitment to society, as well as those leaders that report or work with me, really being able to work with teams and bring them along and to feel empowered in regards to the care that we deliver to our patients and families. That's always, when I think back at legacy, I look back and really believe in the work that, I myself have done, but I'm really about team and being able to leave another organization in a better place in regards to the team that's there to take care of patients and families.
Nice, very nice. Well, as you join us, it's right on the heels of some challenging times for us in nursing, and I know the community has watched us, and we have a wonderful team at Northwestern Medical Center, but we've gone through a lot of growing pains, and with that came a union vote with nursing, and I'm grateful that nurses voted to have that direct line of communication and that relationship. And that really, brings you here. So I know you've only been here a very short time, but what are you feeling and sensing? What's your observations so far in relation to nursing and the core of nursing at Northwestern Medical Center?
Yeah, I would, for the short time that I have been a part of Northwestern, I've really spent time in the clinical environments. And really wanting to see, the nurses work alongside our medical providers and appreciating the challenges that may present. My snapshot of what I've observed truly is that there's a dedicated, committed team that wants to do the best for our community and our patients. Having said that, I would I'm looking forward to the challenge and the opportunity to partner with nursing as a community. We're a community of nurses, whether we're practicing in the clinic or in the family birthing center or on the progressive care unit, and bringing that group together to really understand our clinical practice and to also create some momentum around feeling empowered and listened to.
Excellent.
So it's no small deal. However, I feel confident we will get there together.
Yeah. Well, I think a new perspective and, like you mentioned, listening, that progressive care unit is really kind of a new unit. We've only been in it in a year where we've taken the ICU and med-surg and stepped down and put them together. So there's a lot of growing there too, and workflow analysis. And I know one of the priorities was education for nursing. Whether you're a new nurse or a more senior nurse, education really feeds and fuels them in their work. So as you interviewed, and I know as you've talked since you've been here, and even with the interim chief nursing officer, in looking at what nurses really wanted, it seemed that shared governance was an opportunity to bring the practice of nursing together and to move forward together collectively. What's your experience with shared governance, and where do you see it at Northwestern Medical Center?
My experience with shared governance, being fortunate to practice at both clinical practice when I was a nurse at providing direct patient care, as well as moving into the leadership role, has a strong history of shared governance. So I'm very familiar in multiple roles in regards to shared governance. Similarly, when I went to Mount Ascutney Hospital, we really launched together with my vision and leadership what I would call an intra-professional shared governance model, which allowed all disciplines to come together and create process around those things that impact the direct care clinician. So I feel well prepared to lead Northwestern nursing community and others through a structure that will support clinical decision making that's a partnership. Sometimes you'll see shared words that describe shared governance, clinical practice governance, shared decision making, but it's all really around the foundation in which the work is achieved in a partnership together, and that we all in our roles have respect for one another and have ownership and accountability over our practice and profession. So I'm grateful for the opportunity to partner with the nurses at Northwestern Medical Center. And actually, we're beginning that work this Friday. We have an all-day retreat planned to look at models and make decisions related to what that structure potentially will look like.
Wow. So you have nurses coming together to work with you to make decisions on that?
Yes.
Wow.
Yes.
So nurses are right at the table
right.
making decisions?
That's right. I will always call the question, where is the direct care clinician, whether it be a nurse, a physical therapist, in participating in decision making? At least 50% or more you need to achieve in order to have that have the impact that we would want to realize in regards to this practice model.
So if you were to fast forward like a year from now, or maybe two, I don't know how long it takes to do all of that, what do you hope to look back on, or what have we achieved at that point? So what will nursing be celebrating, you hope, from like a year from now?
Yes, appreciating that shared governance does take time, but I believe we will have a core foundation in the way we are coming together, a structure that really values all clinicians, but in particular our nurses, in their voice related to what matters and the impact that they can have on not only our patients and families, but healthcare in general. So when I look back in a year, I will see that we have an established shared governance model and participation together.
Wow, that sounds wonderful.
Yes.
I can't wait to join you in the celebrating.
Yes.
So it's been an interesting year. And so even when you interviewed with us, I mean, you knew we had gone through some turmoil with nursing. So what attracted you to say, this is for me?
Well, the thing that I really, what I embrace about Northwestern Medical Center is the commitment overall to our community.
Yeah,
and
so
that
true.
This is a community hospital, and I greatly appreciate that. People that live in the community, as well as the employees, want to receive their care at Northwestern, and I want to be a part of that and really work to achieve excellence. So that's very important for me in a role when I'm leading in a chief nursing officer position, to really be congruent with that, and it, just the legacy and the pieces and parts that I've learned, I'm just really thrilled to be a part of it.
That's terrific. So tell us a little bit about your family. Jody, Brody.
Yes, thank you, Jill. Yes.
Hey, it takes a whole family, right, to
That's
do this
right.
type of work.
Yes. Well, I'm fortunate my husband Jody is here with me, and my dog Brody, who's a standard poodle, and actually he's just my best friend, a loyal companion.
Oh, nice.
But I also do have children, a son, and a niece who's very close, and a nephew. Always, as always, family is very important, and friends to me. So it's been great. We've assimilated into the community and getting to know and the region. So I'm excited.
Super.
Yeah.
So you're settling in. You feel it a welcoming community. I know I did when I arrived. I mean, I've been here 9 years now, and it's like it hasn't missed a beat in being so open and welcoming.
Absolutely, and that's one thing I noticed about Northwestern. Everybody's really welcoming. Do you need anything? As well as just traveling around, walking around town. It's been very exciting to be a part of a new community.
Well, our time is gone so fast.
Yes, it has.
We'll have to have you back when you're got more
Would love
under.
that. Thank you.
Yeah, that would be great. So we can talk more about what you're doing. So it sounds really exciting. Maybe we could bring on a nurse or two with you, and they can talk about it too.
Fantastic.
Talk about partnership, right? This would be great.
Yeah. Thank you, Jill.
Thank you so much. I'm Jill Bowen, your host of the NMC Healthbeat show. Thank you so much for joining us, and thank you for welcoming Deanna Orfanidis to our community and to the leadership of nursing at Northwestern Medical Center. Thank you.